Record. Yes, so um, as mentioned, my name is Kunle Adewale. I am the Global Development Lead and also the chair for the Global South Art Net Initiative, also the founder, the executive director of the Global Art Medicine Fellowship Program. And it's been an incredible experience being part of the Accra Art Net Festival for the past few days, starting all the way from July 20th to July 26th, which is today. But within that space of time, it's also several engagement actually that happened across different cities or across different towns, put it that way, within the city called Accra. But again, just to have a quick check-in with all of us today. If you are okay with you just introducing yourself in the chat with your name, just your name and what you do. For instance, my name is Kojo Kumasi. I'm an artist, and so that could just be it. So that way we know who is talking to us this evening, right? So you can use the chat. If you can use the chat, just your name and what you do basically. I think just as a way of introduction for all of us this evening. So kindly please use the chat to introduce yourself very quickly, your name and what you do, maybe like your profession. And if you're a student, just say you're a student. If you're a nurse, say you're a nurse, whatever that is, just give us an idea of who you are so that we have idea of who is present with us this very afternoon. Yeah, thank you so much, Stephen Labby. Always a delight to just hear your voice. Always a delight to have you here, actually. So, Stephen Labby is a visual artist, one of our amazing artists at the British Council on Friday night. Right, so wonderful, great to have you here. We have Lindsay here, Lindsay Kendra Lutudot, who is a nursing student from Knoxford University. Oh, wonderful, wonderful, great to have you here, all the way from Knoxford University. One of our very amazing, outstanding hosts institution for the Accra Art and Arts Festival. Do we have anyone here again as well who is willing to introduce himself or herself to us very quickly before we dig deeper into the closing ceremony today? Any other person? Just use the chat as we mentioned. So we have Latoya Sake. So yeah. So, Latoya Sake, also a nursing student from Knoxford University. Oh, that's amazing. So we have Gloria Ado, a public health student from the University of Ghana. That is amazing, wonderful. We also have in our midst today Doris Kumbla, an educator, also an artist. Really amazing, just great to know. We're having people from different parts of the world here to the UK, US, and definitely different people coming into this space today. Um, just a quick check-in with all of us today. And I'm just going to ask us a question, just more a bit of a reflection in terms of, this week we've learned so many things, especially in the area of creative health, right? So I will ask, so what is creative health to you? Just to the chat, what is creative health to you? So, yeah, I'm typing in the chat here. So what is creative health to you? So if you want to respond, you could just use that to just respond. Yeah, respond very quickly. So I have somebody here saying Kunle Adewale. I don't know. Oh, it's Bartolomeo Amin Ayamga, who is a professional handcrafted artist, a vocational instructor, founder of Amin's Basketry and Beyond, based in Buktanga, Ghana. Oh, amazing. Oh, your work span traditional contemporary African crafts, specializing in authentic Boga basketry and stitched needleworks, custom home accent, and natural fiber creation. Great to meet you here today. Really appreciate you being here today. So, there's a quick question for all of us in the chat. What is creative health to you? Whether you've been part of the session for the past few days in Accra with us, or maybe again you have an idea of what creative health is, like the word creative, then the health. So what is that to use the combination of the two? If you want to respond, you could just use the chat the way we responded with our names. Just respond in the chat, with creative health to you, what it means. So very quickly, we would love to read response from all of us this evening. So if you can, kindly just use the chat to respond to what creative health means to you. Or in addition to that would be, what is one thing that you do that makes you happy that is creative, put it that way. So, what is one thing that you do that makes you happy, that give you peace of mind, that make you calm, that make you find yourself, that give you a sense of belonging, but it's also creative actually. So yeah, wonderful. I see from Sake Latoya very quickly using art to improve the physical and mental well-being of an individual and community as a whole. That's wonderful. That's a wonderful answer from you, Latoya. And I'm going straight to Lindsay. We'll say using art and culture to improve your physical and mental health. Absolutely, you're very, very right. Any other response from anyone? What is creative health to you? Creative health to you, just more as a prompt, as a response. Also, really want to see a response from us this evening. Doris said creative health is using art to improve health and well-being. Amazing. Amazing. Maybe you want to be a little bit specific, with even using the word art. Maybe you want to go a little bit into what that is. What do you mean by art? Is it drawing? Is it dancing? Is it just textile design? What do you mean? What exactly are you talking about? We talk about art. What is that exactly? So will really be great to see when you say using, could be using dance to improve physical health. So that probably could mean the creative health. I mean, maybe using virtual reality to improve health. Or then that again, that is you going to the specifics in a way. So yeah, definitely will be great to hear and read more from other people what creative health means to them, right? So I'm just going to write, maybe also ask us this evening, if you have been part of the Accra Art and Health Week so far, whether you've been part of the symposium or Art and Health Forum or any other segment of the festival, do you want to use an emoji to indicate? Just like use the emoji, either you raise your hand, you use a heart shape, or whatever that is, just as an indicator that you've been part of the Accra Art and Health Festival. So anyone here like myself who has been part of, oh yes, Wilson has been part of that, absolutely. I will use this one here. So let me use this. That is me. You see what I'm doing here? Yeah. All right. I see Stephen want to speak. Okay. What's that? Okay, where are you? Let me see. Oh, okay. I see you. You're raising your hand. Absolutely. That's great as well. So that's you indicating that you've been part of the Accra Tennis Festival. So probably maybe just to unmute you very quickly. Can you describe your experience regarding the Accra Internet Festival very quickly, Stephen? I'm asking you to unmute yourself now, please.
Hello, everyone. Doug, thank you for the opportunity. So it's actually been a great experience from the creative art corridor at the Accra district to the main forum at the British Council. So my general take has been bringing together artists, health professionals, and well-being advocates to exploring how Ghana's artistic practices, cultural heritage can drive public health innovation and strengthen community well-being. Yeah, so that's been it for me. It's been a wonderful experience and getting to meet all these wonderful people. Thank you.
Thank you so much, Stephen. That is really, really great to hear. And thank you so much for sharing. I'm probably going to go to Lindsay. And after Lindsay, I will go to Wilson, okay? Lindsay, I'm going to ask you to unmute yourself now, if that is fine for you to just tell us your experience so far in the Accra Art and Arts Festival, if that is fine with you. So I'm asking you to unmute yourself now, if that is fine. If you can unmute yourself very quickly, please, darling. You can unmute yourself. I'm asking you to unmute yourself. Go ahead, please.
Okay, Doc, thank you for the opportunity. So I was able to join only on Tuesday, where there was a signing of the arts being part for Natford University being part of the Arts and Health Symposium. So I did not really learn a lot, but I got to know that creative health too can be used as medicine to improve our mental and physical health. So far that's what I've taken as a nursing student. Yeah.
Oh, wonderful. Really great to hear your response. I'm really glad to see that you participated so well. I think that's such a wonderful experience to hear from you. Wilson, I'm going to ask you to unmute yourself now, if you don't mind, please. So I'm going to look for you. I got you here. Right. So, Wisin, I'm asking you to unmute yourself very quickly. You've been part of the Accra Talent Festival. How's the journey been for you? What's your take home? What's your takeaway from the entire week so far?
Hello, everyone. My name is Winston, and I'm glad to be here. Well, my take on the whole festival is that art has the power to bridge, connect everyone together. Like there's one thing in all of us, and that's art. Everyone is creative, and if we are able to harness that energy, I think it can really help us mentally, emotionally, and physically in almost every area of our lives. Because it's one thing you are, and then can be used to heal people, and bring unity amongst everyone. Because that's one thing we can all relate to. With there's creativity in everyone. There's this um it art can be used to heal the sick, mentally sick people and all that.
That's such a very profound truth. Really, really great to hear that from you. I'm going to ask Jacqueline, I don't know if you're settled now, or maybe you want to unmute yourself to speak, or use the chat as a response. So, what has been your takeaway so far from the Accra Tennis Festival? If you can, and if you want to respond very quickly, please. I'm asking you to unmute yourself. Go ahead. So we can't hear you, Jacqueline. So maybe one of the things you can do, maybe use the chat box to be able to respond. So, and also think maybe because you are on the road currently. So I think that is fine. So yeah, I mean it's good to hear, different perspectives, and also, I mean, individuals just sharing their lived experience, during the Accra Tennis Festival. Yeah. But then just want to highlight that the Accra Tennis Festival, again, it's a flagship program of the Global South Internet Initiative founded by the Global Art Medicine Fellowship Program, which has been pioneered since 2023 and currently now has replicated itself in over 45 countries plus around the world. And it's really great to be able to do this in Accra this year, even though prior to this time, we've had activation one way or the other in Ghana, including Accra actually, through the Global South Art and Health Week Ghana Pavilion. Right. So, oh, yeah, definitely. There's a documentary. There's a documentary of that already. There's a documentary of that. So we definitely be able to make it available, hopefully before the next 10 days, the documentary. There's going to be a trailer that will be released. And also, I'm going to be showing some highlights from the festival this afternoon with us in terms of images, what took place. But definitely, the documentary of the entire week will be made available in less than 2 weeks' time today. Um, so while we're here today, we have a distinguished guest that has joined us now, who is actually our keynote speaker for today. And I know she's an extremely very busy person and just want to be able to respect her time and such that she can be able to speak with us briefly before she leaves, if she, especially she wants to stay to the end of the conversation. I know she's very, very busy. I probably will make her a co-host as well because already I've activated mute all button. So yeah, so I think I've made a course now, so she can be able to unmute herself um when I'm able to do the introduction properly. Right. So joining us this evening is our very own, an amazing woman, in the person of Dr. Khadija Owusu, who is a TEDx speaker, a medical doctor, a wellness practitioner, a passionate change maker, and an advocate for women's health, girls' health, and every woman's health, everybody's health, actually, not just. Recently, she just completed a program in London, which I'm really jealous of. I wish she just like say, you know what, Dr. K, finish the one you're doing in Accra first, and then let me put this one on hold. She said, no, this one has to go ahead. I believe very strongly because she has put so many things into place to ensure that she's able to move forward there. She is such an inspiration. I've read her bio, I've done a little background, check on her. She's such an amazing, amazing and incredible woman. I was telling a friend, I said Ghanaian women are very intelligent, are very smart, and very incredible. The Ghanaian women that I've met, they are just outstanding, bright, beautiful, brilliant, brave, courageous, inspirational, visionary. And I think this woman actually embody all of the thing I'm saying. I'm telling you, I'm not psyching you or trying to just sweet talk you. Dr. Khadija actually will agree with me. I'm saying the truth. Actually, all of the women I've met, I mean, Doris is here already, right? And many people I believe will agree with me on that. So in order not to really prolong this, I would welcome the founder of Accra, that is the person of Dr. Khadija Owusu, who probably might do a little bit of maybe a better introduction that I would do because she does so much. She's doing so many things. So, ladies and gentlemen, let's make welcome Dr. Khadija Owusu, everyone. Dr. Khadija, over to you, please, ma'am.
Thank you so much for having me. It's truly a pleasure to be here. Hopefully, you guys can hear me. If there is some issues with the connection, whatnot, my Wi-Fi is playing up. Just when I need to engage with you guys, it's messing up. But let me share my screen and then we can get going. All right, are we able to see my screen? Yes. Okay, sorry. I have two screens, so bear with me if I'm looking in different directions. But once again, good afternoon, good evening. It's 5:30 p.m. um where I am in London. And I know everyone, honestly, it's an honor to deliver the closing keynote for the Accra Arts and Health Festival, the 2026 edition. Hopefully, it has been an incredible week so far. I know this festival has brought together lots of people who don't always actually artists and doctors, educators and policymakers, researchers and community leaders, cultural practitioners, and most importantly, young people. And obviously, that combination matters because no single profession can actually build a healthy city. And when we hear, especially myself, hospitals, clinics, ambulances, labs, healthcare professionals, which, are very essential. And as a doctor, I completely understand that value intimately. But long before somebody enters a consulting room, their health is already, they live, the streets that they travel along, the school they attend, the air they breathe, the stories they hear about themselves, and whether they feel as though they belong, importantly. So today I want to offer one central idea, and that is the healthiest city is not simply the city with the most hospitals, it's the city that makes health possible everywhere. And that kind of city can only be built together. If you don't know, our national speaker said we just wrapped up our annual London Summit this week, which was incredible. And we look forward to what's next at the foundation. But moving on. I mentioned before that health begins way before people come into the hospital. It begins whether a mother can move safely through her neighborhood, whether a young person has somewhere to play, create, and be heard, whether an older person feels connected to their community or lives in isolation. And it begins with whether our public health messages are also speaking the same language that people can actually understand and trust. Because if not, then I guess we're speaking to the air, we're speaking to the masses for no reason. And for those of you that are doctors or healthcare practitioners, we're trained to diagnose and treat disease. But cities also produce patterns of health and illness, and they can breed inactivity, possibility, or exclusion. But it also means that health can not only belong to the ministries, hospitals, and clinicians, it also belongs to the teachers, the artists, the architects, the transport planners, faith leaders, those who manage or build technology, families, and communities. So instead of asking, how do we treat illness? We need to ask, how do we build environments where people actually feel safe, valued, and seen? How do we design places where people feel, where people communicate health in ways that connect with their lived experience? Because health isn't an isolated service. And I think that is a notion that I'm really trying to, I guess, change when it comes to especially the advocacy work that I do. We often speak of health in silo, but health cuts across the board. In this day and age where we are very much fascinated or really drawn towards economic investment and how do we, I guess, make more money, or investment towards driving Africa forwards, etc. We need to understand that majority of the African population is young. It's full of young people, and the rate in which disease, especially non-communicable diseases, are rising. We can't continue to talk about investment and profits if our people that are eventually going to manage those businesses, those economies across. Now, if we people and story, first is place. The design of a neighborhood affects if people will walk, if they're going to gather, if they're going to play, if they're going to remain isolated. A school can become a center of confidence and well-being, and a place where distress is also never recognized. A hospital can also technically be excellent and still feel frightening or culturally distant. And I think one issue that especially is predominant here in London is, or even just across the UK, which maybe can be related in the context of Accra, is we're seeing the lack of, or let's say more closure of youth centers or places where young people can gather and play. And in turn, that's leading to the rise of crime, especially amongst young people committing crimes, especially knife crime. You're removing places where people can gather, can play, can even exercise. Obviously, what do you then want these young people, especially, to do if you're not creating that environment for them to be safe and thrive? You're in turn raising the negatives of as to what can happen in the community, and then people not feeling safe at all. Second is people. Health is built through relationships, and people are more likely to engage with care when they trust the messenger. They're going to recognize themselves in the message and believe their knowledge has been respected. If somebody, and I'm sure if you're a healthcare professional and you've had a patient come to you and immediately the patient enters, this happens to me almost every day. Immediately the patient enters the room and sees you. You kind of see the sense of relief on their face. They're like, "Oh, okay, this person is one of me. This person is going to understand what I'm saying." And I know for sure, especially working in the UK, where, there are a number of Black healthcare professionals. There are Black doctors, not as much, but we're getting there. And so whenever I encounter my Black patients, they're always like, "Oh, like, I'm so proud of you. I'm so proud that I came to the GP practice or the clinic and saw you and you are my doctor." And that can definitely translate across all representation is really, really important. Hold forms of trust that formal institutions cannot also manufacture. And so health isn't something that is just needs to be communicated through healthcare professionals. It can also be communicated through our community leaders who even have a stronger power or stronghold over their community members, even more than doctors or nurses. And lastly, the third one is story. Every city tells its residents a story about whose lives matter, whose voices count, and what futures are possible. Arts can really challenge shame. Music can carry information, especially knowing how much we love our music and we love to dance. Theatre can also make an invisible experience visible through storytelling, which can help someone name pain for which they previously had no language. So once again, it's people, it's place, people, and story, and they're not secondary to health. They help determine whether health becomes possible. I'm going to propose three things. And the first one is that culture is a health infrastructure. We usually reserve the word infrastructure and technology, but every health intervention must also travel through an invisible infrastructure of trust, language, memory, identity, and meaning. Now, if that invisible infrastructure is weak, then technically every other intervention is going to struggle. And people don't receive health information as blank pages. They're going to interpret it through their family, their faith, previous experiences that they've had, the local knowledge and stories that is constantly circulating around them. And that's not a barrier to overcome. It's really for us to understand and work with those in order to make sure that we create a practice to help us do so. For example, if we can take a mural, that can begin a public conversation. A performance can explore mental health without starting with a clinical label. Telling can turn statistics into human recognition. We're not saying that art should replace medicine. It can help make health more human, accessible, and trusted. Now, we know that Ghana has extraordinary cultural inheritance, and we are so, so proud of it. And so, this is an opportunity to not just celebrate it, but to mobilize it thoughtfully in service of well being, in service of saving lives at the end of the day. Then next, we often measure access by asking whether a service exists. Is there a clinic? Was a campaign delivered? Were materials distributed? How many people attended? These are often important questions, but they don't tell us whether an intervention became meaningful in people's lives. That's the difference between access and then impact. And that difference between access and impact is where trust lies. Are people going to be able to recognize themselves in the programs that are being delivered? Does it also speak to their reality? And were they consulted before decisions were being made? Do people trust the messenger? And is there a genuine way for them to say when something working? Now, through the work that we do with the young women and girls at the Accra Foundation, we've learned that meaningful engagement begins by listening. With all the programs that we run, all our alumni who graduate from the programs are always returning back to pour into the next generation of young girls that then come and follow through in the program. They're also always helping to shape how we may adapt or adjust the programs to better suit their needs as young women who lack opportunities, who also lack knowledge about their education, health, and empowerment. But that also goes to show, young people, we don't lack ideas. They often lack access to rooms of influence, most importantly, resources and authority needed to act on those ideas. Because a lot of the times, what we're seeing is interventions that are mainly targeted at young people are being decided or dictated by non-young people who are assuming the needs of young people without having them influence that, which shouldn't really happen, to be honest. So trust grows when engagement changes the outcome, and it grows when people see their priorities, language, and creativity reflected in the final design. It grows when institutions return after the photographs have been taken. And also trust can't merely be, just a communication strategy. It needs to start from the beginning when we are looking at design principles. For the second proposition, I'm going to say that collaboration must mean more than proximity. Now, as somebody that is, running or leading at the Accra Foundation, we get a lot of requests that come through, not even just for the foundation, whether it be personally, through whichever way it is. We love to throw collaboration, we love to throw partnership out there without understanding the gravity or the meaning or the depth that it requires. But collaboration is putting different sectors in the same room, and it's not just it's so putting different sectors in the same room is the beginning, but that's not yet collaboration. Collaboration is not just, taking a photograph together, a memorandum, or a collection of logos on the same banner. It becomes real through shared power, shared resources, and shared accountability. When I say shared power, it means that people closest to the challenge help define the challenge in itself. That's artists, that's young people, that's community members who are not simply being asked to deliver somebody else's concepts, but they're actually helping to shape and create that concept as well. Shared resources means that we're not just celebrating community innovation whilst withholding funding, training, time, and institutional access required to sustain it. It's creativity that can live indefinitely. And shared accountability means deciding what success will look like and remaining responsible after the event ends. Who's going to carry the idea forward? Who's going to fund the next stage? How will the community learn from what happened? And what should be different 6 months from now? As a clinician, I might ask whether an idea is evidence-based. An artist might ask whether it's truthful and human. A policymaker might ask whether it can scale, and a community may ask whether it will last. And so the purpose of collaboration is not for everyone to think alike, but it's for different forms of expertise to create a stronger art than any one sector can produce alone. And I'm going to move on to the third proposition, and that is participation is not enough. We need ownership. First step is invitation. You're going to open the door and ensure that people who are usually absent are present. But presence alone can become tokenism. And we see that time and time and time again. You'll have a young person maybe sit on a panel and still have no influence or whatsoever with what happens afterwards. You can have a community representative come and share a powerful story, but somebody else still controls the budget and the strategy. But the second step is also co-design after invitation. We're going to allow people with lived experience to actually alter the answer. And that requires humility from institutions, which in my experience, I've seen that it can be quite tough for them to do so. But also humility from professionals, knowing that, yes, credentials matter, but that's not the only source of knowledge that we can pull from. People understand the pressures, relationships, and realities of their communities in ways that no external reports can capture. And the third is co-ownership, sharing resources, like I mentioned, recognition and responsibility. At the Accra Foundation, our mission is to develop the next generation of African female leaders. And that work reminds me that empowerment can't mean telling young women to use their voices while keeping every single decision beyond their reach. If we want young people to shape healthier cities, we must give them more than a microphone. You're going to need to give them mentorship, funding, information, access, and a pathway from idea to implementation. And that is exactly what we do. So what does this mean for my lovely Accra, Ghana, that I need to hurry up and return back to very soon? Well, I mean, I believe the city can lead through three practical moves we need to design together. For every major public health priority, ask who else should be at the design table. If the issue that we're speaking about is adolescent mental health, which I think is so key and paramount and a really urgent issue, I believe, in this day and age, where are the young people? Where are the teachers? Where are the artists? Where are the digital creators and families? If the issue is healthy aging, where are the elders, the cultural institutions, the faith communities or faith leaders and designers of public space? Cross-sector partnership should begin before even the proposal was written, not after, and the funding has arrived. Second, we need to pilot locally. We don't need to wait for a perfect national model before we start acting. Schools, clinics, neighborhoods, and cultural spaces can become places of careful experimentation. If you have a school, you can ask them to test storytelling for emotional literacy. If you have a community, you can explore how music or performance might strengthen health communication. If we have clinics, we can work with artists to improve how patients experience the actual clinical environment. Just because a pilot might be smaller doesn't mean that it's not significant. And if I think back to how we even started at the Akaya Foundation, we just started small. Classroom, 100 girls, and 5 years later, we are a what's the word? Is it intercontinental non-profit organization working across 3 countries? That's Ghana, the UK, and more recently, Kenya. So always start small, and starting small doesn't mean it's insignificant. A well-designed pilot can truly generate trust, evidence, and momentum for you to continue to keep going and continue to build. Third is learn openly. Creative health must be taken seriously enough to evaluate. We should ask because our measures must all agency, not just, the quantitative metrics like attendance. And then we need to share what we learn, including what did not work. Share it in order for it to be applied or scaled in many different contexts according to different cultures. Design together, pilot locally, learn openly. And that's how this festival potentially can implement. Now, as we close this festival, every sector represented here has a role. Everybody has a role. Everybody has a responsibility. Everybody needs to be held accountable. To the policymakers, create the mandates. We need to recognize creative health within strategies, partnerships, and budgets. To the health leaders, we need to open the system, invite cultural and community expertise into health education, patient experience, prevention, and public communication. To the artists and cultural practitioners, continue to challenge, translate, and imagine because claiming your place as partners in health is important, not simply performers at health events. And to researchers and educators, we need to develop the evidence and prepare practitioners who can work confidently across disciplines. To the funders and the private sector, invest beyond the launch. Invest, invest, invest. We need to fund patient work of relationship building, evaluation, and growth. And lastly, to the communities and young people, continue to hold institutions accountable. Always ask, always question, and make sure you keep no matter what, especially for the sake of your fellow young people and also for your communities. Your participation is not a favor to you. Know that your knowledge is necessary, it is paramount, and let us resist the comfort of inspiration without implementation. And so before leaving this festival, identify one relationship that you will continue, and I'm sure you've probably made loads, you've networked like tons. Identify an idea you're going to test, no matter how big or small. Test it and identify one commitment for which you are willing to be held accountable and even ask somebody else to hold you accountable. A movement is not created by a single week of activity. It's created when people leave the room carrying responsibility. So I'm going to end where I began by saying the healthiest city is not simply the city with the most hospitals in it. It is the city that makes health accessible, or in the schools, in the clinics, or in cultural spaces. It's in the stories that we tell, it's in the relationships that it protects, and in the power it gives people to shape the conditions of their own well-being. Accra, we know, has a cultural intelligence. And so this festival, I know, has demonstrated the partnerships and imagination that already exist. It's highlighted that. The question is what we're going to build from them. So I pray we build a city where an artist is recognized as a partner in public health, where a doctor understands that listening is both a clinical and civic skill, where policymakers see culture not as decoration, but as an asset, and where young people are not only described as the future, but also trusted as leaders in the present, and where communities are not an audience for an intervention with the first authors. So if you choose shared power over token participation, long-term partnership over isolated projects, and community ownership over design, I believe Accra can lead a continental movement for healthier, more creative, and more equitable cities. And so the healthiest city, once again, is one that we build together. Thank you very much for having me this evening. I'm going to conclude there. And I don't know if we have time for questions.
We
Once
do.
again,
We
thank you for
do.
having me.
That's amazing. Please let's celebrate Dr. Khadija for that masterclass. Masterclass. And I hope you're going to send that slide over because we're going to highlight it on the
Sure.
page so that everyone can follow it. So we're going to adopt the brand color we're using for the festival itself and then be able to take some of your words and be able to have people to follow the conversation basically. I see people already have questions for you. We have from Stephen Labby.
Uh-oh.
Stephen Labby, who is an artist actually based in Accra, and he's asking you kindly, what will you propose as a framework for making creative health sustainable in Ghana? I mean, that's what the question from several of the points you've raised this evening. So, um,
Mhm.
Stephen is asking you, what will you propose? What will you suggest? I mean, he's asking you. Stephen's asking.
Oh, okay. This is a interesting question. So, what will I propose as a framework for making creative health sustainable in Ghana? Just out of interest, Stephen, if you can share a little bit about what you do, so maybe I can perhaps give a bit more of a tailored suggestion or just a bit of background. Yeah.
So, Stephen, I'm probably going to ask you to unmute yourself so that you can directly ask Dr. Khadija your question very quickly, all right? So, Stephen, I'm about to ask you to unmute now, and then you can ask your question in a way that is very clear so that you can respond appropriately. Over to you, Stephen, please.
All right, thank you, sir. Hello once again, doctor. So I'm a visual artist, but with a recent
Right.
interest in mental wellness for young creatives. So from that
Mm.
angle of things, I would want to know a practical framework that will make creative health sustainable in Ghana, especially with mental health issues. Thank you.
Okay. So you said you're a visual artist
Yes, he is. Yes, he is a visual artist based in Accra, Ghana.
with okay, with particular affinity towards, let's say, adolescent mental health. Is that what
Absolutely.
you're
Yeah, absolutely.
um
Yeah, that's
drawn
what he
to?
said. No, so that's what is mentioned. That's what they mentioned more
Yeah.
for. But it was very
Okay.
specific. I mentioned
Mm-hmm.
creative. Actually, it was very specific about the demography. He said creative, so it was very
Yeah.
more specific about the population
Okay.
and the group.
Mm-hmm. So I think you know what I've recently seen in more recent times is Ghana in itself is really starting to embrace the creative sector as a whole in general. So I think we are on the right track in terms of knowing how important the creative sector generally is, full stop. But I guess now it's diverting in towards understanding that under the creative sector, there is creative health and how important that is in terms of shaping the health of, I guess, the general population and especially young people. And like you said, with adolescent mental health. So, number one, in order for when it comes to the framework or in order for it to be taken seriously, I would definitely say policy is so, so important. It's easier said than done. And knowing the context that we come from, where if you want to implement policy, it's going to take God knows how many years. But in order for there to be some seriousness attached, there needs to be policy and creative health needs to be embedded within Ghana's national health or education strategies, full stop. Once there is that policy embedded, the next thing that I would say is partnerships. We need to be able to foster collaboration between the governments, the healthcare providers, the artists, the cultural institutions, academia, and communities. We need to be able to create general boards of these different sectors when it comes to different health issues that we are deciding to tackle. Not even just looking at it from the disease perspective, but also from prevention, but also looking as well. You know, giving examples that I mentioned about murals in different communities, or even just how we translate with storytelling. The other thing is evidence. So it's gonna be quite difficult for anybody to act on. Um, I guess, let's say, taking creative health seriously or in a sustainable manner if there is no evidence. But we need to invest in research and monitoring to demonstrate the impact and build that case for the long-term funding of the creative health sector within Ghana. And lastly, it's people. We need to train healthcare professionals, artists, and community members to make sure that whatever we're delivering is culturally relevant, creative health intervention definitely to young people in the region of, uh, you know, the younger community, period poverty. We, northern region, ago, had to come the word redo structure workshops with from medics here in the UK itself.
Oh no. So I think our internet is having issues. So, but that's such a very powerful keynote. It's very, very powerful, very, very strong and very powerful remark from Dr. Khadija. And also, and definitely we're going to be having a slide and translating them into visual so that people can get to follow the conversation. While we're waiting for Dr. Khadija, I'm going to ask Doris probably to respond as well. So, I mean, you hear probably you read it some. Oh, she's back now very quickly. Yeah, so I'm gonna
I'm
okay, go ahead, please. All right, go ahead, please.
sorry, I don't know. My Wi-Fi is disgracing me today. But yeah, just to where did I even cut off? I think did I mean was I speaking about translating to
Yeah,
different
absolutely.
context?
Yeah, yes,
Yeah.
please. Mhm.
Okay. Um.
Yeah,
Oh
you're
goodness.
talking about training. You mentioned training in the area for
Yes.
artists for health. So that's where you were actually.
Yeah. So making sure that whatever is being delivered is culturally relevant, and I
Oh,
think
yes.
sustainability will only come from if we are really integrating healthcare and community well-being within the national framework, as opposed to just having it as standalone projects.
Yeah, yeah. That's such a very powerful response to the question. I'm going to go to the second one very quickly here from Angela, who said, how can older people integrate their experiences into creative health to guide younger people? And that's a very great question, actually.
Mhm.
What do you
Yes.
think? Yeah, go ahead and respond very quickly, please.
Sure. So I think with older people, and I don't know if you anybody has also heard this notion in terms of generally speaking, the stories that are being carried within or the lives that are being carried within the older generation are simply dying with them. A lot of that old historical knowledge, wisdom that they are carrying, we are very poor in documenting those kind of stories. So I think how we can integrate their lives is basically by integrating their lived experience through them sharing stories, through them mentoring younger generations, by co-creating arts, music, or cultural projects together. That's how we can not only just preserve the traditional practices that existed before, obviously with reason and making sure that it aligns with, today's guidelines, but also making sure that we're not simply just applying what may have worked for them back then to and assuming that it will work right now. So it's not just going to support young people's well-being, identity, and resilience, but I think it's also going to foster a sense of intergenerational learning. It's going to strengthen community connections with the older and younger generations within a community and make sure that valuable life lessons aren't just gone with them, but they're also passed on in really meaningful and creative ways.
Such a very powerful one. Thank you so much for that, Dr. Khadija. There's still much opportunity for one or two more questions very quickly if anyone want to ask question. I'm probably going to add Doris to this conversation, Dr. Khadija. Doris is someone, I think she's an artist. When she was in Ghana, she's based now in the US. She is an amazing, amazing. Probably Doris, I'm going to ask you to probably talk about what you've been doing in Ghana before you left for the US for studies. And again, also, I mean, many of the things that Dr. Khadija raised, which I think are very critical conversation that she has raised this evening. What is your response to those questions? Are creatives in Ghana really ready? Are they really taking accountability? Are they really responsive? I mean, you even be in that space as an artist. And then what does it feel to be a creative in Ghana or being in Accra? What motivates creatives? What moves them? What stops them? I mean, you've been in that space for a very long time. Probably to be great that Dr. Khadija is able to hear from you, lived experience. I think would be great so that again it's just balancing this conversation very well. Very quickly. Over to you, Doris, please.
Thank you so much, Dr. Adewale. Hello, everyone. My name is Doris. From the accent, you pick the Nigerian accent. I quickly introduce myself as a fine blend of Ghana and Nigeria Jollof, because I am the Ewe Fanti girl, dad Ewe, mom Fanti, but born and raised in Nigeria. So I'm a fine blend of the two jollof rice. Don't ask me which is sweeter. Both are sweet. That's it. Anyways, I was just going to say, Dr. Kajida, thank you so much for your presentation. I really liked the systemic way you looked at it. I like that you were thinking from a very empathetic place because once you start to think in silos, like that's already a major problem. And I appreciate that you thought through all of the different sectors and everyone's part in it. I would say from my experience, I've been in the arts working in the arts for over 13 years now. And it's a battle. If you're not battling systems, you're battling, structures. And there are other things like, how would I say it? I'm trying to pick my words now because we're on record. But it's a general African challenge, if we're being honest, around like so many systemic hurdles to climb or navigate. And I would personally say that in it all, as much as these things are very key and necessary, the reality of the challenge is many times you still have to move, be in motion despite the fact that the system is not ready. And that's where the challenge is. And that's where the challenge is for all sectors. And I really love it, going back to what you said, like own it. Co-creation is great, but take it beyond that. Own it. And ownership might then look like, how can I start where I am? How can I think like no matter how much paper drafts, I mean, how much you draft anything on paper, if you do not get your hands dirty, you would really not fully understand what's involved. And this is me telling you from my experience working. When I moved to Ghana, I think it was 6 years ago, I started doing the arts in the hospitals in Ghana. We're using the arts as a tool for therapy, specifically in the pediatrics units in Ghana, helping children. Literally, the experiences of like coming in and hearing a child text you to say, I'm having chemo tomorrow, Auntie Doris, don't forget to come. I would love to do art before we start. Or just when they are getting medication or we're finishing up art, they're telling you, Auntie Doris, please don't leave. I will soon wake up. Like the joy of hearing a child tell you they are looking forward to waking up to do art instead of looking forward to because it's very painful. It's not the easiest thing for even an adult to experience, talk more of children. And then being in that space and then finding out how parents pretty much are all battling these challenges individually. And I had the privilege of then working with the oncology units, the hospitals, to then say, okay, how can we set up maybe a parent support maybe body of some sort to just help them talk together, build community because you start to see a divide in the hospital because so when we go in, typically there is no payment or anything, it's a free service. But because a parent is so burdened, they don't even know, like, is it going to be safe? I don't want to find out that I told my child to do art and now I owe you money. So you see the divide happening in the hospitals where some children are doing art, some children are literally just stealing glasses at those who are, but because their parents said don't do it, they can't. So these are like real world being in the system challenges that you have to face. I remembered how in partnership with the hospital, we had to raise funds to pay for surgery for one of the kids who had to do a bone marrow transplant. And another child who's battling for her life gifted her art to be auctioned just to pay for that surgery. Like the community, the intent, the heart behind it. The summary of what I'm saying is like just get your boots on the ground, do the work, and then as you work, pay attention to what you're hearing, what's said and what's not said, and then navigate that with wisdom. If you want to work in anything, especially in public health in Ghana, do not belittle the leadership of any organization. Oh my God. They are going to. So, like everybody, follow the hierarchy, pay attention to what's said, what's not said, honor everyone in the system because one person could frustrate the whole thing. I'm managing my words, but from my conversation, you will start to pick up on these subtle challenges that we faced in our experiences. So yeah, when I think about it, it's a very passionate conversation for me. because I know what it feels like to be in the system. And I also have learned from it, learned from, oh, I wish I did this better, or I wish I were wiser with this, which is why I'm saying, like, get your boots in the ground, pay attention, honor everyone in the system, and take it one day at a time.
Yeah, I'm going to respond to you very quickly. Thanks so much, Doris, for that. And I really love that, again, Dr. Khadija is a medical doctor, which is really good. She's spoken from that perspective as a medical doctor. You are an artist, and it's really good you're able to speak, which again is more of, again, hearing from the creative side. And you have also collaborated and worked with a medical doctor to host a pavilion in Ghana. We don't want to share that with Dr. Khadija because she's here today. So how did you get to work with the medical doctors and artists to host a big event on art and health in Ghana in 2024? A very quick one. I'm looking at the
I
time.
would say just navigating like networks that you have. It started with just networks, starting with even Dr. Adewale's networks. There was a body of like awards, I can't remember, but he pulled from the networks that were already in Ghana. And then I just started making the connections with them, and then we started talking. It's like you said, give ownership, share ownership. It's not also about just making it about you. So I think for me, leading that, it was very important to make it about what strengths are we all coming into this place with, and then research what are the main challenges, not what do I want to do. It was a case of we were researching to see where the major gaps were in Ghana, and at the time it was stroke. At the time it was female health, education, and something around autism. And these were things that in some spaces I had interest, some places I didn't have that exposure. At the time, stroke was the number one killer disease of the Ghanaian people. And then we just thought, okay, who are the people who are most affected? At the time, it was like mostly people from, like, of course, more lower cadres of the society. So the market women, those who you don't see every day. And for us, it's like, yeah, we want to make it about a conference, but would conference really reach the people who we need to educate?
Mhm.
And the strategy we decided to do was we created a sculpture. Half was mobile, half was immobile, and took it to the marketplace and then demonstrated early signs of stroke,
Mm,
just so that they could really see something they could hold on to and
mm,
be able to do something
mm.
when nobody is in the picture. And of course, then we moved into systems, thinking about setting up workshops, got professionals to speak, and just try to find ways to make sure that we were not only thinking about the one party, but as many parties as possible. And then we set up art exhibition to raise funds to pay for stroke, that initial response that a potential stroke patient could have to just maybe save their lives.
Yeah, I'm going to.
Yeah, so that's that, and then we did a follow-up.
I love this already, and I'm going to throw this, but probably back to Dr. Khadija, which I think. I mean, there are many artists that want to do good. I mean, there are few things that I saw when I went to Ghana in the area of mental health and in the psychiatry. But I visited one of the Ghanaians' oldest mental health hospital in Accra, the oldest actually. And what I saw there was devastating. Actually, we're going to take it up. We have already something working on that. There was an artist that felt like was, oh, let me be very careful with my word. Yeah, I think because it's on record, so that's something I also need to be careful with. So something happened to off record. I will be talking about that, but there were a lot of concern around what is happening within the hospital with creatives working in the hospital and how sometimes system take advantage of the creatives trying to support care and caring for other people that need care within the system. And in the long run, you realize the people who are caring for people that need care in the system are trapped and sometimes are uncared for. And the states of those individuals, the quality of life is very, very low in a way. And then one of the major things that I came up with, I think again, it's almost like a thing, especially in the global south or in Africa, as you may call it, is funding. This is probably my fourth year in England, and I know there's National Lottery, there's Art Council, there's National Endowment in the US, there's different, funding agency in a way that exist. But what do we have? Sometimes it's more like for government, you're talking about creative health. They're not thinking about what that's because for the politician, the question is, what is that bringing to my pocket? I mean, I'm talking about a not forward-thinking politician, policymaker in Africa context, where I came from, which I probably you agree with me in terms of that's not their priority. So then What should people do? I mean, many of the things you raised today were fantastic, and but in real practical terms, how does that, how is that realistic where funding is not on the table, when government
Mhm.
probably is not going to get involved? So the question would be if the government refuse to get involved, what should we do? And I think that's a question for two of you. And I will start with Dr. Khadija first.
I really think this is a really important question because I don't think we should be blinded to the fact that our government institutions are very problematic. Um, and a lot of the time we often can fall into the trap of, okay, let's wait for government to do this, let's wait for government to do. If you wait, if you sit and wait, you'll wait forever. Maybe there'll be one day where everybody wakes up and something will happen. But in the meantime, whilst we are dreaming for that day, you still have to continue to try by all means to do what you can. And I guess that's probably, related to how we are able to do what we do, especially in Ghana. There are quite a few private institutions that are willing to support certain projects. And I think those, off-head ones that could potentially work, maybe having a look at some of the private health facilities. What are they doing for their corporate social responsibility? If mental health, if we're proposing a health project, mental health creative project, and maybe they don't necessarily see the creative aspects to be um they don't really see the whole point of it, then how about you create a holistic mental health project that has the creative aspect as one arm of the overall thing that they can decide to fund. So well, yeah, like one arm is the private health institutions. The other thing also is I do know that there is a national lottery sort of in Ghana. The National Lottery does make donations to support certain projects. I know they've supported a project that one other organization that I know in Ghana they've supported before. So they do exist, they do support projects. As to what kind of projects, I'm not 100% sure, but I think definitely looking at the private institutions and even just maybe NGOs as a collaborative, seeing what can be done together with artists coming on board. It maybe it shouldn't just be one particular artist where all the work falls on them in order to, I guess, maybe transform a psychiatry unit. Bringing on board a collaborative of artists that are willing to maybe volunteer a little bit of their time to do one little part. But it doesn't also have to just fall on the artists. It can also fall on the ordinary person who has no idea what even art is, but would love to be interested in supporting this project. Anybody within the local community, the local area, getting a school involved, having their kids involved, their art students, in order to make this something that they can collaboratively do, so that there is also that sense of ownership. If there's ownership, then maybe people will take maintenance very seriously. And we know our maintenance culture already is trash. So if there is a sense of ownership as well tied to it, then we can all be responsible for making sure that our health facilities um, provide the best environment for the people that need it the most.
Wonderful. I see Doris want to speak, and I'm going to throw the question back to two of you shortly, very quickly.
Absolutely. For me, let me zoom in as an individual in Ghana. What I did was I happen to have a mural business in Ghana. So I do murals for like corporate spaces in Ghana. And for every time I did that, because we always did interactions, I started communicating with my pool of clients about what was going on in the hospitals. Not at the time, it wasn't particularly for any reason besides just helping them know that we had an altruistic side to the business and we cared about, the community beyond just, making money. So when it was time for us to, for instance, set up the parent support group, and we thought to set up an art exhibition in the hospital so that we could pull people into the spaces of the people we actually wanted to be seen. Immediately I get calls from a restaurant owner, big restaurant owner in Ghana to say, I was actually Googling the other day about like cancer and stuff like that. I'm thinking, okay, what I initially suggested that my manager should provide for the exhibition won't be wise. Let's do this. Immediately that told me that that's ownership. And I'm sure that, I mean, it started because I was always intentional about communicating, the value of the things that matter to me. So I think it's always going to start with you being intentional about defining what this work is going to mean to you, what level of commitment you're going to come into the work with, because all our initial projects doing murals in the hospital were also self-funded. So every time we did a project and we had extra materials, we then moved it to the hospitals and started doing murals in the hospitals. So those were our own strategic thing. And I know it's going to be different for different people, but I'm just saying that to say that this is where you have to then begin to pay attention to what's available to you. What do you have at your disposal? What other places or partnerships could you potentially have? What I did also was, because I needed manpower when we're doing the hospital project, I did a video of the hospital, me working, did a video and requested for support on LinkedIn and on my social media platforms. And all I said is, if you don't have money, that's okay. All I need is manpower. Come in. Just say, I want to help, even if you're not an artist. And on the part of us, the creatives, we try to make the patterns of the work very simple and basic so anyone who comes in could help. And that helped us with manpower. We're able to do a lot.
That's really wonderful. I'm going to throw this question back to two of you because you're now both in the diaspora, right? Which I really think I'm in the diaspora as well as a Nigerian. So what do you think the diaspora can do? I'm looking at the area of support. I mean, we've spoken about funding, right? What can the diaspora do in a way that can we have something like a trust fund that is built as a pocket? Because I know in the diaspora, if you have a lot of Ghanaians here will probably donate maybe £10 and then maybe give £20 one way or the other. And that pocket of that probably could do something within a unit, like Dr. Khadija mentioned. Like you don't have to do the entire piece. Just pick a corner, just pick somewhere. Don't do many places. So what can the diaspora do? I mean, more like a call to action from two of you. I will start with Dr. Khadija first, and then you can speak. And then I'm going to show you some of the things Dr. Khadija mentioned. Must show you a little bit of highlight of what happened during this week. Dr. Khadija, if you can just wait like 5 minutes, I will show you some of the things you mentioned so that you're able to hear some of the things you've mentioned that's been actioned already. You get to see the thread of that. And I'm going to be very quick with this, yes. So, but now it's just more like a call to action for professionals in the diaspora, how
Yeah.
to get involved in creative health investment. I use the word investment now. Back
Mm-hmm.
home, Ghana.
Yeah, well, I think the diaspora are a really key part of this whole conversation. And we're blessed to be in a place whereby a lot of, individuals within the diaspora want to do all they can to help, to support, to invest. We see that through the work that we do at the foundation, where, a large proportion of the work that we do is supported by individuals of the diaspora. Not that, and that just doesn't necessarily mean funding. It can also mean their time. And that comes through, or that translates through the virtual programs that we have for our girls. But also in terms of individuals that are actually going to Ghana, whether they're Ghanaian or not. We have people reach out, I'm going to Ghana. It could be maybe I'm going for somebody's wedding, or it's my first time in the country, or my family member's funeral, whatever. But whilst I'm there, I want to make sure I have an impact, and we help curate that experience for them. Every December, we, maximize on the whole Dirty December shenanigans, in terms of really preaching about, yes, you're coming to party in this Accra, but whilst you're partying, let's also think about, the people that actually live here. This is their day to day, and some of the struggles that some individuals may be experiencing, not just in Accra, but also in Ghana. And so we run Project ISI, and that's our annual school building project, where we contribute funds towards building schools in rural communities in Ghana. This January, we unveiled our primary school, and as part of that experience, whereby, with the unveiling day, we all get on a bus. The school is in the Eastern region. So we get to the school, and it's a full immersive day for our volunteers. Majority of them come from the diaspora, who have also donated towards the project. And we get involved in engaging with the kids, but also in painting a large mural on the wall. It can be, the volunteers, everybody gets a paintbrush, and we're contributing towards painting the wall that will remain in the school for the kids to remember this memorable day that these are the people that actually came to rebuild our school to make sure it's a safe environment for us to stay educated in. And it's not even just volunteers, the kids will also grab paintbrushes, and it becomes a whole collective experience that is really brought together by the diaspora. So aside funds is also their time and making sure that those of us that are, have established our organizations or means of making sure it happens. I like to say that Akaya sometimes serves as that bridge between connecting the diaspora to those back home. Myself, I was born and raised in the UK in London. I've never the longest time I spent in Ghana is like 2 months. And so I understand what it means to be a member of the diaspora that is so deeply drawn to your ethnicity, your heritage, where your parents are from. And so relating to people like me and making sure that we make it happen, then absolutely, why not? And I think something that just deters a lot of members of the diaspora is the trust issue. They feel as though you give your money to somebody, they're going to spend it. Another thing also is they just simply don't know how. And so Akaya, we serve as that bridge to whatever logistics it is. My team in Ghana will handle it. You focus on whatever funds or fundraising you're going to be doing, or whatever time you want to be dedicating, and we'll take care of the rest.
That is really amazing to hear, in terms of facilitating and creating a system of trust, actually, because I think trust is such a very big factor
Yeah.
with people who have worked so hard and then to just throw their money to the wind. Nobody's going to do that in any way. And they're all hearing here now. Stephen, you're here. Winston, you're here. You hear that, all of those things. People really want to support. The question is, can individuals on ground be trusted with resources for implementations again? So Doris, very quickly, and then I'm going to just do a quick highlight, and then we just close this evening. Very quickly, Doris.
Absolutely. I'm just going to piggyback on what Dr. Khadija said. It's so true because I already wrote it down here that like accountability is the thing that we need to learn as a people.
Mm.
That's the thing that we see in these parts of the world where you could literally go on a random non-profit organization and you can see their financials public. So that already helps you see that systems that are accountable can be trusted. And the way I would say you could think about exploring this, thinking about the diasporas, is you could intentionally, or from a diaspora's perspective, intentionally explore organizations that have proven accountability in their structures, and then just vet that to be sure that it's not just presentation. And then on the part of the foot soldiers on ground, build a structure of whatever you're doing and build a system of accountability. Don't wait till you need money, because once you already have a system, anybody who comes on board can already see that, oh, this is already established, because I think that's like the crux of what makes diasporans reluctant to really invest in the thing that they want to invest in back at home, even though they're passionate about it. Can I trust you with this? And I think also think long term. I think diasporans want to see long term people. Like it shouldn't just be a touch and go thing, because that's the thing that doesn't help us sustain this. What's the long-term picture? What are you thinking about doing? How do you want to improve on it? And then think partnerships. One thing I have learned is home, we all want to shine alone. Me, I did that. I did that. You can only go so far. That proverb says, the African proverb that says, if you want to go fast, go as one. If you want to go far, go as many. So think about that. We're a culture of community anyway. It's not an unusual thing in our culture to think about working together.
Amazing. I think that reinforced what Dr. Kadia mentioned earlier on. The city that the healthier city, the one that we build. And right. And I think again, it's just more of thinking about what that feels like. So I'm going to do like about 5 minutes recap of what happened during the week, just showing you images and showing you when you spoke about collaboration again, who and who was involved in this year Accra Tennis for that to see who and who those individual were. So I'm going to do a very quick, let me see. And definitely when the documentary is ready as well, I will probably be able to share. Here I'm going to go all the way here. We had a lot of people who came on board as partners for the Accra Artists Festival, right? So I'm going to share this with you. So this is more like an highlight of the events all the way from July 20 to 26 actually. So we have some of the logos of the people that collaborated with us, talking about academic institution, and of course foreign mission like British Council, Ghana, and several others, Youth National Body, National Student Body, and also private owned organizations here and there, right? So again, these are some of the people who were part of the Accra Tennis Festival as speakers. As a contributor, some of them are neurologists, some of them are politicians, actually. Some of them are, say, influencers, actually. Some of them have massive, massive social media followership, right? So this kind of help to amplify, what is being done in the country, using their platform, using their voices, using their images and their involvement in all of this. So these are some of the people who are probably in the media. Some of them are actually working in the hospital. Some of them are probably working in the mental health space. So it's quite very diverse. Some of them are working also in disabilities as well, disability groups. Some of them are owners of NGOs as well. So these are some of the speakers that we have who were part of the event. Some of them individuals that came on board who probably came in as hosts or moderators for the event. And I know one of our advisors actually who happened to be a DJ as well came and provided a free DJ service at the British Council. It was really great. So it's just watch her play and do her DJ thing. And after the show was a keynote speaker that same evening. She was a keynote speaker. She was also the DJ. And it was really incredible to see that transition, of this beautiful woman here. So it was really great to see that. And we have more people getting involved. A public health physician who's also a musician. We also have some people who actually, like, for instance, a Nigerian who is living in Ghana for a long time, getting involved. So it brought a little bit of Pan-Africanism into what that looks like, even though it's a Ghanaian thing. But again, it's just that we're not isolated. Ghana and Nigeria, like you said, you're a mix of the two. Like you said, right? So we've seen a mix of the two, but largely this is almost about 99.9 Ghanaian driven, and also to have a bit of Nigerian being part of that is just an opportunity to see what is happening and how we can support ourselves as a thriving community. So we have the involvement of the professor from the university, the pro chancellor as well from the university, and of course you're here today, Dr. Khadija, you're here now. So these are the build that you see. This when you talk about the branches, who made this happen? These are the collective. These are the people that made this entire event this year a success. So on Monday, July 2020 actually. So we were at Jamestown in Accra, actually, where we had conversation around youth activism and also creative health and mental health as well, where there was a lot of storytelling, young people coming around to say, oh, they write exam, they failed. Some of them were feeling discouraged, and then so through storytelling, they were inspired to have faith in themselves, to, like, even though you were born in Jamestown, but again, there's so much possibility in your future, right? So, and for me, it's also a bit nostalgic as well, because many of the things I saw at Jamestown felt like the slum area where I was born in Nigeria. So there was that mirror effect when I saw that, but was really a great experience in terms of storytelling, inspiration, and also motivation. Again, art and health mean different things to different people. For a child who has been feeling matched back to back, it doesn't mean that that child is sick. Probably just need encouragement and positive motivation that could make that person to just, move ahead into the future in a way. And the other day, we of course, were able to sign an MOU with the university, more of capacity building for the nursing school, more to co-develop a curriculum, for the school, which is really, really a big deal. So I'm a fan of the, Global Ultimate Fellowship Program, which again was started in the year 2017, 2018. And then with what we've done over the years, we've been able to train over 1,000 students and professionals, across 60 countries around the world. And then for us thinking about how do we continue to integrate, this creative health program into institutions, not just as a Zoom program or a virtual program, but kind of catalyzing that into institutions and structures that exist within the African system, and then to see how can we collaborate. We talk about what would be together as the healthiest city, right? So, but also thinking about education and capacity building would be, to see what this is. And I think for me to also say this is also going to be this is the first ever that we're seeing in Africa actually. Go check it. There's no nursing school that has integrated creative health programming. So Ghana actually is taking that front seat, which is a big deal actually in the entire festival. It has never happened before. But again, this is a landmark um, and also turning point in the area of capacity building for future health leaders in Ghana, right? And then also an opportunity of having reception with the pro-chancellor of the university, who was really thrilled and really inspired, with what we're set to do, thinking about, what's going to happen in Ghana through this exchange program or this co-designing of the curriculum with the faculty members of the university already and with our faculty member within the fellowship. So that was great to see. So on Tuesday, that same Tuesday, we had academic symposium. So at Knoxford University, I mean, for us, it's very important that we're not just talking about creative health just as a thing of passion, like, oh, I'm very passionate. Passion is not enough. Knowledge is very important. So do you understand? And I know Dr. Khadija, you mentioned policy, research, and all of that. All of these are body of knowledge that we not just say, "Oh, I'm a passionate artist." That passion is not really to take you. It's not going to get you. You are not going to get a lot done with just being passionate, but you being resourced with with knowledge, with evidence that can help to inform policy, right? So this was an opportunity to like again, talk to nursing students and professionals that were actually at this particular academic symposium. And one of the things, and I don't know whether it was you, Dr. Khadija, that mentioned it, or it was Doris. So there's a national pilot project we just activated during this event that involves youth engagement using creative health, creativity for public health messaging and all of that. It was, when I sat back watching these, so we collaborated with the National Association of Students of National Association of Health Students of Ghana, actually. That is NASAG, actually, to be able to make this happen. So when we did it was a bit late. So we had about 30 young people within the age of 18 to 20 who applied for this, who submitted, different talent, either theater, drama. They are some of them at medical students, but they did different creative stuff just that they submitted. So we shortlisted 10. So and then so there was a grand finale, which was actually this particular event where we brought judges. The judges, some of them were artists, were public health professional, was a mix of discipline. Actually, the judges were not just creatives, but also kind of balancing what we want to do. And then so these 10, young students between 18 to 20 across different, department within the health in Ghana actually presented spoken word, music, just different, talent, all of that. So, and the three of them actually emerged as the winner. So we had a boy actually who did the spoken. In fact, all of the winners actually were spoken word artists. Was really powerful, and hopefully when the documentary is ready, because again, this is a national pilot project, and then again we're going to amplify this. And like I said, this is also the very first time in Africa, if not in the world, that you have health students. We have Britain, is it British Got Talent, American Got Talent, those version. Sometimes I feel like entertainment, but this is more health focused, where like you're bringing the talent but using as health messaging. Either and with the recent flood that happened in Accra, many of them brought that up in their presentation, right? Some of them brought up the issue of sexual exploitation, sexual reproductive health, and so many of this came up in their talent display. So we had the judges here. Some of them, one of them was former Miss Health, actually Miss Health Ghana, and it's very really interesting to find people who are really into health, like thinking about talent, but talent through the lens of public health, which is really beautiful in a way, right? So it kind of just with some of the points you raised in your presentation, just showing you what happened at the festival to say we've already seen the indicators. We're seeing this accelerator. We're seeing them as incubators. We're seeing the possibilities already popping up, in what was done during the. And then one of the things we did also during the festival, we had an honorary designation of Accra Art District as a creative health corridor. So when we spoke with this particular team and they mentioned what is happening in Accra with the stress, you just feel like Lagos, they never slow down. It's just busting here and there. But this very tiny corner, not tiny corner, but really they have like 12 programs, pottery making, adire making, textile design, art gallery, about 12 programs in this particular space. So, and for us, the very first time in Africa, we have this particular space in Accra designated as Creative Health Corridor. There are people who have mental health problems. They also work with children with disabilities and all of that. And on the average in a month, they support about 120 people. That is massive. And then to just see us not as decoration or as just like a mere activity, but just that. I mean, there's a lot of evidence that says that you just being involved in art making is good for your brain, for social engagement, for relationship building. So, and then so this is one of the landmark, that we had during this event, for Ghanaian people to say, you have the asset now, leverage the asset you have. You have this particular place. The other part we had, of course, on Friday, we had the Art and It Forum actually in collaboration with the British Council, where we had fantastic, individuals who spoke about, art and health and art and healing, even through the lens of heritage and even cultural narratives as well. So we had Araba, I can't remember her last name now, who was living in the UK. She had lived in the UK for about 8 years. And she just said, you know what, let me take a break. Let me visit Accra. And then she was in Accra for 2 months. And that's how she stayed back, never came back to the UK. And then so from her personal experience in terms of what she has seen, but also like what asset is available in Ghana. And today, she's an advocate for cultural healing and all of those things, continuing the work right there. And of course, during that same event, we had our exhibiting, we had an exhibition, and then these are some of the artists here who were part of that experience. It was really great. Was an opportunity for us to be able to. Stephen was asking you a question the other time. This guy, this is the guy here who was asking you the question, who was also part of the exhibiting artists. So it was really great to see many of them keep to us and say, thank you for putting this together. The creatives were so excited that there was an opportunity for them to have understanding of health, of what the art can do for the health or the health sector. It was really good to be able to have that conversation. And then we have I was opportunity to speak to medical student of University of Ghana actually on that same Friday in the morning. And then when you spoke about pilot projects and all that, so one of the things at the end of my presentation was that they were grouped into three groups. They did speed piloting for 10 minutes. For 10 minutes, they came up with three ideas now that the university probably is going to pursue actually. So I didn't design for them, I just gave them the prompt, I gave them the question, you're Ghanaians. What are the problems in your health system? So they came up with three ideas and being inspired by many of the things of course that is happening in Nigeria that I showed them in terms of the mental health unit, the use of virtual reality and technology, AI, gaming, even for health purpose. And so this group of medical students, in different three angles, came up with three. One of them group came up with palliative care and for the aging population, what they're going to do with that. And what's really great because again, was not me trying to feed them with the ideas, but rather they came up with the ideas themselves. But again, this is also something we're trying to see. We're going to be receiving the type document version of the ideas, and then we want to see how that can be refined and redefined clearly in a way that is fundable and it can be supported for activation. So that's one of the things we hope that will happen. Of course, we have a lot of plenary session, roundtable discussion, having people from the policymakers, the people in the academia, practitioners and professionals also being involved in the entire conversation. Talking about the aging population, so there was a research component actually this year to the Accra Art Festival. So we had a participatory art research on aging, healthy aging actually with University of Glasgow. Art Glow from Malawi, and of course the Global South Art Initiative. So, and then so we had culture custodian here. This is it, you call them Queen Mother actually, who was an embodiment of knowledge. There was so much she was sharing about aging. She brought a game they used to play. And I had the opportunity of actually playing with her. And what's really great for me that it was my first time of meeting a Queen Mother in my lifetime. I've never, as an African. And I feel so blessed, like, oh my God, it was really nostalgic. And I had a very nice picture with her. Like, I'm going to frame this. I'm going to show my children about this. Like, living in the UK now, going back home, meeting Queen Mother, meeting, the cultural custodians, meeting all of the people who are really, preserving our heritage. And but through the lens of healthy aging, what should we do? They spoke about the family unit, eating well, walking, just giving us the right information, and was really, really an incredible experience. And of course, we had Creative Health in Motion. So a visit to Jamestown, just go see what Jamestown looked like, was really beautiful and amazing. And of course, earlier today in the morning, between 5:30 to 7:30 a.m., they had a photo walk, which was led by a doctor. a pharmacist led a photo walk. How incredible. How amazing. And again, that's all part of it. Like you can be a doctor, but again, medicine not just about, pills or just books, and but again, medicine actually or care can be creative, like you moving your body and getting involved in other things. And then we also had a satellite program, that happened as is it Passway you call it? Is it Passway you call it or Passway? I don't know how to pronounce it. It was at a resort actually where it was a satellite program for self-care day, people collaborating and they making things happening actually. And of course, so Accra Artist Festival, what next activation? So one of the things we did this year, and I'm going to mention this investment. So the Global Art in Medicine Fellowship Program, by reason of this festival, had invested about 30,000 Ghana cedis. So, for instance, in the university, about 10 students out of many of the students that were part of that conversation for medical art and clinical spaces conversation lecture, so 10 of them actually have been designated to receive full scholarship to be part of the Global Intimacy Fellowship Program, which on the average costs about 150 pounds or 200 pounds. Now, the program actually has increased, Doris, you might not know. If you convert that to Ghana cedis, it's almost about 3,000 Ghana cedis. If you multiply that about 10 people, that's 30,000 Ghana cedis. So earlier on, when we're talking about the role of the diaspora, actually, back on what is happening for someone like myself who funded an initiative like this, which is really global now, and in a way that this is traveling around the world, what are we doing is also kind of supported with knowledge building, knowledge exchange, and just capacity building and investing back into the next generation. And that's exactly what we did. So this is the beginning of many beginnings for Ghana and for Accra. And then that is my presentation just to like share with you. Probably I would love to hear your thoughts, Dr. Khadija, and also Doris as well. Just to share with you. That was it. Go ahead, unmute yourself.
Okay, I don't mind going first. Honestly, I think it's really incredible to hear what has gone on the past week, and it's a lot. So how you've even been able to manage it, and you said you're now back in the UK is even mind-boggling for me. But it looks like it's been an incredible week and I love the fact that each day has produced something tangible for which the next steps can be built on, because a lot of the time you might have one-off engagements here and there, and then you don't hear anything else afterwards. But you've built that consistency throughout this entire week, and for more to even continue to happen, and for more for us to look forward to, and hold people more accountable towards them. So congratulations to yourself, to the entire team. I know it was not easy to probably put on. And so, yeah, this is really impressive and amazing. Congratulations.
Absolutely. I typed in amazing. Big congratulations to you, the entire team. Um, there's hope. It's very inspiring. It brought a lot of hope. I love that it also has a lot of sustainability structure to it. So it's not just going to be one moment in time, but it's going to be something that continues to build on itself. Yeah, well done.
So much.
Congratulations.
Thank you so much
Yes.
for that. And again, this is again about kind of reinforcing what Dr. Khadija mentioned. The healthier city is the one we build together, and I think it's such a very powerful word. So, and I think again that's a classic example of what you just said, and just showing an example of what Ghana did, for the past few days. And again, for us also is like like you mentioned, more of not a one-off thing to see how we have all this scaffolding, in a way to continue to build and just bringing more bricks and putting more things to be able to move forward. But I think it's been an incredible evening, with you, Dr. Khadija. I know like we had like 20 minutes, but it was just really great to bounce the conversation around because your keynote was really very deep, was very strong. And I'm probably going to ask you to email it to me if that's okay with you, so that we can be able to, again, for people who are not able to make this meeting today, we can be able to share visuals with them. But beyond that, also like for many people who registered, this is recorded. So yeah, it's also on YouTube, and then we can share the link with them so that way people can catch up on the recording as well. And it's also great to be able to have Doris all the way from United States today joining us, UK, US. That's a very powerful connection. We hope to see more Ghanaians in the diaspora getting involved in the work back home. the healthier city is the one we built together, and that's a very powerful word, and that's the world we're living with today. I don't know if anybody have anything to say, but I think on behalf of the leadership team, for the Accra Arts Festival 2026, I want to say a very big thank you to our amazing keynote speaker, Dr. Khadija also, who is an award-winning medical doctor, an inspirational leader, change maker, who is really doing great. And also for Doris Komla, who has been one of the strong pioneer foundation for art and health or creative health programming in Ghana, to have her here today. And also for many of you who actually have some very busy, important thing to do, but you decided to show up today for Ghana, for Accra, for Africa. So we'll see you, we'll recognize you. So we also appreciate all our team, all the volunteers, all of the speakers, all the collaborators across Ghana, across Accra, who showed up, who came up, who decided to be part of this global movement and to be part of this experience. So we hope that we can continue to build and build more in this regard. And lastly, before I close this evening, one of the things I was going to say is, which I think maybe Dr. Khadija might not know, is what you're seeing in Ghana is more like an incubator, it's more like an accelerator. So there are bigger versions of that we've been doing around the world. For instance, in 2023, we had the international convening of this nature in Egypt, in both city, Alexandria and Cairo, massive. We had about 26 countries represented, including WHO and many other big global health bodies actually who were involved. In 2024, we were in Qatar, in Doha, actually, which was incredible. So the version you saw now, there's a big version of that we had the experience in Doha, in Qatar. In 2025, we were in Sao Paulo, in Brazil, bringing again the global community. And this year, we're going to Hong Kong in November. And Doris, I've mentioned that to you. So massively bringing global leaders into the creative health. You spoke about evidence, Dr. Khadija. Again, it's more of, again, policymaker getting involved, people who have done a lot of research, and to be able to share during these, global events, and then individuals who are participating can go back home and take those knowledge back home. So our hope, of course, is that in 2028, and that is what we're going to see, before the world will show up in Ghana in 2028, it's just to ensure that we get Ghana ready and prepared. So all of the things you're seeing now, they're accelerators, they're incubators, they're sparks, they're just sparking things here and there, that when the world show up in Ghana, there's so much to show the world, there's so much to tell, there's so much to show and tell, to say, this is ongoing, not as a tiny thing, but rather that organizations are collaborating, government is getting involved, Ghanaian health system is involved, the Ministry of Health is involved, the Ministry of Art and Culture is involved. So this is not people or organizations working in their silos, but it's something we hope to see in 2028. And I hope, Dr. Khadija, you will be able to make it, because we would love to be part of the speakers. It's usually very high level. I tell you, this is a very high level global event. And I think your presentation today is a world class, and I'm giving you that feedback, and I feel like the world need to listen to you. And I think such a forum, such an event in the area of art and health. I know you speak in different events, but when you're talking about the biggest in the world, this is where it happened here, where you see so we hope so. So after this meeting, just go back to your calendar, just put there, Kunle has mentioned this. I will, and we hope that this will happen around September or October, actually. So I'm giving you already idea of what the calendar looks like. Um, Either September or October in 2028. But before that time, you will see me connecting with you, and hopefully I will see you in London very soon, where we probably will meet in person and talk about this. And we want to be able to ensure we put structure into place, system into place, for continuity and sustainability, local ownership, local collaboration, local involvement, local leadership. All of these are the things we're seeing across different cities around the world. I want to be able to see that in Accra, hopefully by the grace of God. All right. So that being said, 2026 has been an incredible experience. A long, very long week. I'm a bit tired, but I'm not out. Really, really tired, but not out. So if your camera is, let me just stop recording actually. So if you don't mind, we could just